So Dr. Wiesenthal, I was hoping, I know that this morning you had a session in which you discussed lessons learned from, I suppose, your implementation project of KP HealthConnect. And I'm hoping that you can talk about maybe 5 lessons learned.
In no particular order. I think it's crucial to understand that these projects are not information technology projects. No offense intended to all the IT professionals. You know, when we made mistakes, whether with this kind of project or related projects, that they were sort of coming from IT. They would feel to clinicians, and I use that word broadly, physicians and nurses,
yes.
As if something was being imposed on them, and high caliber knowledge workers like doctors and nurses don't respond well to being ordered around by anybody.
Nobody likes that.
So it's a recipe for failure that you see over and over and over again. Another one is that our budget cycles in healthcare, like everywhere else, tend to be annual. These projects are multi-year, and budgets have to be carved out for several years running as best as you possibly can. You have to be able to talk to the finance people on their terms. And if you're asking them to set aside capital for a major investment, then they have to see it and understand what the return on that capital investment is going to be, so they can compare it to the other uses of capital that they have. A third lesson learned is to pay attention to your infrastructure, your IT infrastructure, because you will stress it in ways that you couldn't possibly have imagined.
There was a little bit of news surrounding that, I think.
For us?
Point. Yes, for
yes, and that had to do with actually power. So it wasn't that we didn't have enough servers or that we didn't know how to configure them. We ran out of juice. So that's infrastructure issues. Some of them are easily played for, others unanticipated can bite you. We learned a lot of lessons about what not to do in terms of software acquisition and development. Then we had to figure out what to buy. And there are 2 ways of tackling that. One is you look in a particular sector, pharmacy or lab or documentation and you say, I'm going to get the best of that. I'm going to get the best pharmacy system,
best of breed.
Of breed. And then my IT people will just weld it all together. They can do that. It just takes a lot more time and costs a lot more money than anybody imagines. And
it's more complicated than you first think about.
Way more complicated. And so we realized, even though it meant literally everybody in each sphere of work inside of our organization had to compromise, we were better off licensing something that was built from the start to work together. The integration was already done, but that was more valuable than the best of breed.
And so these key ideas, these key lessons learned, would you say apply to, can be scaled, so to speak, to
anybody,
small hospitals as well as...
If you're a 75-bed hospital and you haven't got your clinical leaders engaged, they're not going to like it. If you don't have a good budget, and by the way, one other thing to emphasize is that's a total cost of ownership budget. So it's a mistake to think that I know what it's going to cost me to license software, and I know what kind of hardware I need, and so that's it. That's not it. More than half of what we budgeted and what we ultimately had to spend related not to those things, but to training, helping people through the change, and what we could account for in terms of their lost productivity while they were making the change.